Hi, everybody. Today's August 24, 2023, and I'm honored to have Clayton Baker. Dr. Baker, tell us about yourself and what you've been writing on lately.
Yes, Randy. Thanks for having me. I really appreciate it. I'm a practicing physician. I also do quite a lot of writing. I am a practicing internist for over 25 years. I grew up in New York State, upstate. I did my undergraduate at Harvard in bioengineering, my medical school at McGill in Montreal, and I came back to Harvard to Beth Israel Deaconess for my residency. I've been in practice ever since as a practicing general internist. Over the years, I've done ICU medicine. I've done inpatient medicine. I currently do just outpatient medicine, which is what I've been doing since before the COVID era began. I've also done quite a lot of teaching from 2012 to 2018. I was clinical associate professor of medical humanities and bioethics at the University of Rochester. And I'm currently still practicing. So I've been writing a lot lately about what the effects on the medical profession have been due to the COVID era, how we've really seen the veneer in many ways be pulled off of our profession over those last 3 years.
I think medicine has a beauty, and it's always been deemed as an art. And here we have, the masking pulled down on medicine. What have you found uncovered in the way medicine's been practiced of late?
Well, I think that, first of all, the traditional and very well established fundamental aspects of medical ethics have been just dispensed with over the course of the COVID era. And that's deeply disturbing to me because, as we both know, when you have a patient, very often you're seeing a patient as a doctor, you have a tremendous amount of power in that relationship. And the capacity or the potential for abuse is tremendous. And that's why we have medical ethics. That's why patient autonomy has always been in the modern era, and even going back to Hippocrates has always been touted as being so important because you have someone who's vulnerable, you have someone who may be afraid, may be sick, may be mentally ill, may be distraught. That's just, patients are commonly all of these things, confused. And you have a knowledge gap between yourself and the patient. Typically, that's absolutely a huge, tremendous gulf. And the ability to hoodwink somebody, the ability to take advantage of somebody, the ability to mistreat somebody is there every time you interact with a patient. And it's so important that you reinforce that this is a healing profession, that this is a helping profession. If you're in it for money, if you're in it for power, if you're in it for bureaucratic ends, then you're in it for the wrong reasons. And I think that that's what I've found, is that so many people, particularly at the higher reaches of the medical establishment, I really believe are in the field for the wrong reasons, and they're doing the wrong things. And they have just dispensed with medical ethics to a terrifying extent.
And just to play devil's advocate, and this might literally be devil's advocate. I think the despots through history have always seen themselves as heroes. I doubt necessarily, Mao on his deathbed or Stalin would see themselves as villains. They thought they were remaking society and trying to do great things, and they, in order to make an omelet, a few eggs have to be cracked, that kind of thing. And just wondering whether you think people acted evilly in their own minds, or whether they were trying to do some kind of population-based medicine. And is that ethical?
I think you are touching on a very important point. And I think that that's part of the reason why it's so hard to get people to revisit their decisions and admit when they make mistakes, because they are ideologues. And remember the old book that everyone read in medical school called The House of God?
Yes, that's
and it was
Samuel Shem.
Samuel Shem.
Well, that's his pseudonym. He was a psychiatrist locally here in Boston.
Exactly. And he wrote this satire of medicine in the 70s called The House of God. Very comic book, very kind of Kurt Vonnegut
I
type
loved
of
it,
book.
actually.
Very, how shall I say it, politically incorrect in the extreme.
Yeah.
And he has a quote at the beginning of the book, and it's a quote of one of the conquistadors, believe it or not. And it always stuck with me. And it said, "We came here to serve God and also to become rich." And that always stuck with me. And if you think about how much money that little guy Hotez has made in service of his ideology, if you look at the hundreds of millions of dollars that Fauci has made, it becomes easy to realize that this ideology pays. And, if you follow the money, it's partly ideology and it's partly just money.
Well, I'm going to slightly push back on the money part, because I don't always think that money is the entire motivation. I think that it is a kind of a social, you want to think of it as a social disease. It's a socialism aspect. And I think they are looking for notoriety and fame rather than money per se. And, I've seen the headline about Fauci's making hundreds of millions of dollars. I don't think that's the case. I actually delved into that. I went to the NIH, it's Open Secrets or whatever it is, had parsed some of the NIH grantees. And Fauci has patents for HIV-related materials. I'm not sure whether he's made in the hundreds of millions. He apparently promised it to go to charity, but it had never followed through on that, which is always an interesting thing. That reminds me of Amber Heard, same quotes in the Johnny Depp trial, that she was going to put everything to charity. She hadn't yet, but she will, but she hadn't. And Peter Hotez, he's been working on a Zika vaccine for Indonesia, and he says all the funds for that are going to go to charity as well. And I think he's reasonably transparent on that. I don't have, I'm not privy to his finances. I personally think it's a matter of fame and notoriety and power, and other things can accrue from that, which are payments in kind, for your book tours, for your speaking fees. So I think a lot of the graft comes above board, as it were. Like Hillary Clinton, when as soon as she hit the Senate, U.S. Senate from New York, she had like I'm not going to get the number right, but like a $5-6 million book deal. It's not because her books were going to sell, or did they sell? It's because that is money that is above board that can be given. So I think there's a fair amount of regulatory capture, and I think there's sinecures and board, seats and whatnot after you leave the CDC, the NIH, whatever you get on a seat on Pfizer, that kind of stuff. I think that is fairly well documented. But I'm just going to push back on the actual money part through, their in kind actions.
I guess we needed to get a forensic. A forensic analysis of their finances, a forensic accountancy done on them. The reports I've heard are pretty impressive. I mean, I can't say that I can independently verify them.
Right.
But
well, I think money is made in the NIH and the NIAID, from patents. And I think there's a flow, a positive flow. It's like, combing your hair one way versus the other. I think people go with the grain at the NIH, and I think the general pathway in medicine of late and throughout the WHO has been pharmacologic, and specifically vaccinologic. And I'd like to actually get to your articles and points that you make. So I can show some of the pieces for our audience, what you have. But maybe, I don't know which of these you'd like to speak on first. This one here is solution to vaccine troubles in 10 sentences. But maybe you could talk about, since we're on this topic a little bit, the pharmacological path to softcore totalitarianism. I mean, we've already mentioned Stalin, Lenin, Mao, and whatnot during this one episode. I mean, during the first 10, 12 minutes here. So maybe you can tell us a little bit about what your intentions are in this article I'm not going to leave it up per se, but people can find it.
So basically, it was kind of just a phrase I coined in my first Brownstone article, this softcore totalitarianism. And the point I was trying to make was to distinguish between what I would call full-on hardcore totalitarianism, like today, perhaps the best example would be North Korea, where people are at a starvation level of existence by and large, as opposed to one where people are really don't have civil rights or civil liberties to the extent that they believe they do, but they either don't realize it because their standard of living is adequately high and their creature comforts are present, and or they don't care because that's the case. And I think that that's really what we're not creeping to, I think that's where we're at in the West. I think one of the things that was truly astonishing to me during COVID was what happened in the so-called liberal Western democracies and in the Anglosphere liberal Western democracies. You know, some of the most oppressive places with regard to COVID lockdown restrictions were places like Australia, New Zealand, to a lesser extent, fortunately, blue states in the United States. And you've got to ask yourself, why does a society with such a well-established sense of individual liberty that goes back to, Runnymede in 1216 or went to 1,000-year tradition of the king doesn't just get to tell you what to do. And, so now basically they say you can't leave your house. And then, in Australia, they literally did send people off to camps, if they were positive. They didn't lock people into their homes and weld the doors shut like they did in China, but it was the next closest thing. And this didn't happen to anywhere near that extent in sub-Saharan Africa. This didn't happen to that extent in South America. This didn't happen anywhere near to that extent in India. It happened in these supposedly free nations in the British Anglosphere. And to me, this really stood out in high relief, because these people have to either have decided, I don't care about the Magna Carta, I don't care about my civil liberties, or they have to be so complacent that they think, this is just a short-term kind of thing. But you realize very quickly that it's not a short-term thing. It's a permanent attack on these. I had an argument with a cardiologist friend of mine in Home Depot early in the pandemic about forced masking. This was in mid to late 2020. And he starts in with me about how I said, the Bill of Rights doesn't say it's null and void if there's a pandemic. It doesn't say it's null and void if there's a nuclear war. It doesn't say there's, under any circumstances, it's the fundamental law. And when he acknowledged that fundamental rights were being taken away. And I said, it just doesn't. And he says, the founding fathers didn't know about pandemics. And that's literally not true. That's literally, I said, listen to yourself. I said, Benjamin Rush, who signed the Declaration of Independence, was the guy who originally brought the smallpox vaccination to the United States back after the war. He knew about smallpox. George Washington had smallpox. Thomas Jefferson lost most of his family, including his wife and a couple of kids, in a typhoid epidemic. These guys knew 100,000 times more about pandemics.
Not only that, but they did it in a world without antibiotics.
Right.
As a tiny footnote, I like words, and I was wondering, vaccination, where does that word come from? It's actually the similar word, in Spanish, a cow is vaca, and similarly in Latin. And so vaccination actually refers to cowpox, vaccinia, variola. And so what they were doing, it was the early stage of preventing smallpox. They used cowpox, which is a little bit more benign for humans because it's cows. And so they took vaccinia and they called that vacciniation. The vaccination actually comes from the smallpox episode. And just as another tiny footnote, since we're on Washington, Washington actually did have a mandate, as it were, for vaccination of his troops with the cowpox against smallpox, because he wanted to keep his troops in good order and worried about any kind of biowarfare by the British and or losing efficacy by illness. But he mandated for his troops. But this is a military thing. He didn't mandate it for a population as a whole. He didn't mandate it for I don't know, Virginia, whatever. He didn't do anything like that. It was a wartime thing, and still soldiers are obligated to do things that regular citizens are not. Sorry for those diversions.
No, not at all. That's great. And I think that, but the point is, and I always, forgive me if I don't want to sound arrogant. I don't want to sound like I'm smarter than the next guy.
You might very well be.
But here are two people who are refuseniks, if you will, of the whole COVID mindset at a high order. And we have a pretty good, at least working knowledge of what medicine was like regarding vaccination and epidemics in the 18th century in the colonies. And this cat has no clue whatsoever. And he will stand there and pontificate about what people do know. And, it's not a pair of chopsticks. It's a cudgel. We are going to beat this system into existence. And that's what this was. We are going to shut everything down. We'll let it go when we feel like it, or when we have so much pushback that we have to give it back to people in bits. We will then coach them that here's the solution to the problem. And we will never even tell them that we started the problem in the first place. If you're somebody who really believes that that's a public health approach, you have to be of such a absolutely dyed-in-the-wool ideology that, again, it's something that can't be disproven. It's something that cannot be refuted. It's an article of faith. Public health as a religion.
Yeah,
I
think we've sacrificed actual religions. We closed the doors of churches, not marijuana dispensaries, and I don't think strip clubs, but we closed the door of churches. And I suppose in the 1918 pandemic, there was a Dr. Tuttle who was the erstwhile Dr. Fauci, and they closed churches temporarily then, but there was some pushback, and people said, well, there's no faith that's not strong enough to withstand absence from church for some period of months or years. I was reading an article in Forbes on this not too long ago, but I actually dispute that. I mean, I think that public health is its own thing. If you actually ever read the Journal of the American Academy of Public Health, I mean, they're not necessarily public. They don't have genuine public health concerns anymore. They've turned into political concerns, and I think there's a confluence of public and politics come from the same root word of the people, but it's not necessarily the people writ large in a democratic sense of what the people want. It's a matter of dictating to the people, and so I think there's kind of I think there was an unfortunate abdication early on in the pandemic, as it were, by our elected officials to the public health nuts, or the public health officials, and I think we were kind of misled. We were led and misled by these hyper-focused people who want to look at strains and percentages and R factors and all this kind of stuff without looking at actual base human needs. And I suppose so I actually have a question here coming at the end of all that screed, which is where did you stand at the time for masks and vaccines, and how did you run your practice, and how did it actually evolve or coexist with the dogmas and dictates of New York State, et cetera?
That's a big question. So, well, the first thing that I would say to that is when my first response was the day I can get back into clinic and see my patients in person, I want to do that. That was my first, I'm trying to think back to the very earliest days of the pandemic. And that was my first thought, because, I've been in practice for over 25 years, and talking to someone on the phone is not like seeing them in person. It just isn't. And the other thing was that within a month or two, I had some time, like everyone did, sitting around, and I watched 2 or 3 episodes of Tiger King with my family. And I said, this is for the birds. And I started getting on the internet and started reading up on things. And I realized that this virus was not nearly as deadly as advertised, that even in, goodness gracious, April, May of 2020, it was pretty clear that this essentially ignored children, that it was, potentially deadly to really old people with comorbidities, just like the flu is, of course, right?
Yeah.
And that these 3% mortality rates were absurd. It was probably more like 0.3 or 0.03%. It was more like the flu. And what I realized was that this was really like, obviously it's a different family of viruses, but this is essentially like a really bad flu year, was the conclusion I drew by about, I don't know, I couldn't give you a date, but within months. And so my first feeling was, I need to get back into the clinic and see my patients. And as soon as I was able to do that, I did so. The second thing that was actually very interesting was that I actually had relatively few. I had multiple, but I had relatively few acute COVID patients, just as it turned out. The COVID up here in upstate New York did not have the huge onslaught that was present in New York City. It came on much more gradually. And so essentially what I found was, it was essentially impossible to get some of the early treatment drugs for my patients. It just wasn't going to happen. They wouldn't get filled. And so what I did was I developed the best alternative. This is, as time goes by, later on to that, using the FLCCC protocols and whatnot, and just kind of did the best for my patients that I could on an outpatient basis. And I just kind of cobbled together a plan of action for people. But it was something where that was in excess from what I think most people were doing, which was basically that absolutely absurd. And this is the other thing, like I said, not being able to go in to see my patients was the first thing that really bothered me. The second thing was this just go home and wait until you get sick kind of thing, which is absurd. Of course there's something you can do for somebody. And so that was how I kind of handled the early stages of the pandemic. As the vaccine situation developed, there was another sort of warning sign that I saw. And I have always been a fairly conventional physician when it came to vaccines. I've never been someone who's been, I knew who Andrew Wakefield was. I didn't really pay much mind, one way or the other. I thought, yes, there's an awful lot of vaccines. I didn't have this many vaccines, but it didn't really register, wasn't on my radar screen prior to COVID. But when they started saying we're going to be putting these vaccines into use within a year, that should be a very simple thing to come to mind. But a year is not long enough to test any medicine whatsoever. Right. That's absurd. And I said, this is absurd. And it's dangerous. And then when I realized, started to look at the different platforms and realized that they're using this mRNA platform, I realized that this was a deeply problematic situation, that you're basically experimenting on the population at large with an entirely new platform. And so at that point, it became very quickly, I did not take the vaccine myself. And I held out with my kids as long as I possibly could. My boys ended up going to college, and they were 18 years old and they were going to go to college. But I managed to convince them to do the Johnson & Johnson, which I thought was less with less downstream danger,
Yeah.
and so on. So we just tried to do it as I tried to just string it out as long as I could in many, many ways. And I was fortunate. And this is one thing that I've learned from this, is that when you find yourself in these situations, a lot of these things, when they're trying to mandate them on you, it's a big game of chicken.
Absolutely.
And you have to hold out as long as you possibly can. And you don't necessarily make a big stink at your job, but you don't get it done, and you just don't get it done, and you just don't get it done. And then lo and behold, sometimes you don't have to.
Yeah. Now there are a lot of similarities in my pathway. I did not want the mRNA modality. I didn't want to take the vaccine at all. I saw no reason for it. I'm 67 years old, but I'm good health. I play tennis. I'm lean. I don't smoke. Never did. Blah blah blah. No medications really. And so it's like I don't think this is real. Big problem. Ultimately, I did. After getting the vaccine, did get Omicron the following year. I personally think Omicron is sui generis. It's its own version of coronavirus. It's not SARS lineal descendant. I have an article on that. Maybe we can pop up.
I agree with you.
And people keep saying COVID-19. Like, dude, check your watch. It's 2021, 2022, 2023. This is no longer, your grandpa's, SARS is no longer ancestral. They actually call it ancestral SARS-CoV-2, nor ancestral SARS-1. And nor is it the VOCs, the alpha, beta, delta, kappa, lambda, whatever. It's none of those. Omicron is its own thing. It emanated from southern Africa someplace. And, coronaviruses have always been around. They're the second most common named cause of the common cold historically after rhinovirus. Right. And I think people have no idea about this. Nobody really thinks about this. They think coronavirus is like something that just landed like an alien from a spaceship. And no concept that coronavirus has always been around, and they're the common cold. And moreover, I think there's been a huge disservice to the population by I don't know how these reports emanate, but they're pretty, everyone's in lockstep saying this is the most transmissible variant yet. Which that's actually really good, because transmissibility is inversely proportional to danger and virulence.
Right. Exactly.
If you have something that's horribly, dangerous and lethal, it does not pass. And so, Ebola tends to be flash in the pan kind of thing. It's horrible. Nobody wants Ebola, but you don't see, Ebola pandemics move across the globe because people stay away from the thing, and the people who have it die. And so, there was never, every single version has been literally more transmissible than the previous because it is literally less dangerous than the previous. And so, this has been kind of I don't know what the deal is, why this kind of misinformation comes along. I'm going to bring up two points perhaps you can comment on. One is from the illustrious Dr. Hotez, as mentioned above, and the other is from Dr. Fauci, as mentioned above. Hotez, there's a little clip passing around the internet now, which has Dr. Hotez under the Trump era saying exactly what you said. There's no way you can have a safe and effective vaccine after a year. This is inimical to the process because you need 3 to 5 years to do all the safety challenges. Blah, blah, blah. These are vaccines with long-term issues, and you need a long-term to examine them. And then in 2021, under President Biden, whatever, his mind has changed, and he's pro vaccine. So the clips, 1, 2, 3. There's 2 before and 1 after, and his eyes actually look different. Eyes are like the window of the soul, and there's kind of a kind of a darkness. I don't want to use the E word, but it looks a little bit evil. There, I used it. I'm sorry. That he's saying something totally contrary to what he just said. And the second example is 2005. I think Dr. Fauci on C-SPAN. You can find it, where he says, natural immunity is the perfect immunity. There's no reason to have a vaccine after you've had the illness. That's my Fauci. And
it's not bad.
Thank you. And then now he's like, basically there's a thing called a booster, which is after you've had the illness, and people are vaccinating after the fact. Now, I think this is actually contrary. Again, we talk about words. This is contrary. It's not literally contrary to the word vaccine, but the whole concept was prophylaxis, prevention. How is it that we came to this part where we keep throwing a vaccine? What is it? Einstein said, the definition of insanity is doing the same thing over and over again, expecting different results. And we're doing this for an illness people already have had, for a virus that's long gone. The ancestral one is long gone, and it wasn't pertinent to the variant strains until Omicron. Omicron's harmless. Why bother? We don't vaccinate against the common cold. There's so many open questions in medicine. I bang my head almost literally, not quite, but figuratively, with a lot of people that I run across, medically, and who scream at me about how crazy I am, and yet they've just totally changed all the rules. It's like I'm playing chess and they're playing laser tag. It's just like a weird thing. They just have taken away all the rules of and precepts of medicine. I don't know.
Mm-hmm. I think you're right, and it's a good point, because it's not just the ethics that have been, I think, thrown out the window. It's also the basic scientific precepts. I remember going to medical school and sitting through microbiology class and sitting through the lectures on the viruses and the bacteria. And I think to myself, pretty much everyone else was in the auditorium. And again, was I the only one who was paying attention?
Yeah.
If you have any kind of a evolutionary system from top to bottom, time passes, the organism mutates, and the mutations which help it to survive and reproduce better prevail. Period. So if you have a virus and it first gets into a population of animal, they have this sort of relationship that they have to build over time. And the subsequent strains that become the dominant strains are universally going to be more transmissible and less virulent. That's just the way it works.
Bingo.
Period. It's done.
End of story.
And I'm thinking to myself, am I nuts? And no one even, it's like this basic concept, which is it's not without some complexity, but it's not beyond the capacity of the average physician with an IQ of 120 or something, and people they won't even consider it. And I think that the ideology has taken over. I think the other thing that's taken over the population at large, both within the medical profession and without, is people have stopped thinking. I think people realize that a lot of this doesn't make sense. I think they realize that a lot of this at some level, at least unconsciously, is nonsense. However, when you've been sufficiently hoodwinked for a sufficient period of time, and your paycheck depends on you continuing to remain hoodwinked, there's a lot of cognitive dissonance you have to tolerate, right, to stand up against this. And you'd rather go to your grave than face that. Now, those of us who said this was BS from the beginning, we've gotten over that hurdle. And so now we just see more evidence. And but the cognitive dissonance, people don't tolerate much of it. And it's not, how much someone can tolerate is not directly proportional to their native intelligence based as IQ. I've noticed that. In fact, sometimes I think it's inversely related. I think the Forrest Gumps have more ability to say this is nonsense. No,
that's an interesting point. It's a team sport. I mean, I think a lot of the power, I went to Yale, and it's a small community college, in New Haven, and a lot of bright people there. I remember getting there, I was like, not quite in awe, but I was like, oh my God, this is kind of the Elysian fields of intelligence. You have all these conversations that happen. And I don't know, maybe I'm looking back at it romantically, but I remember, I certainly thought of it at the time. And I've been to reunions and so forth, and same kind of thing. I've been shouted down. We had one, on a lot of these topics that people, they don't have reason. What they have is cohesion. And I think this is almost a left-right thing. I think the left is better at cohesion and the right is better at independence. And those are probably identifying traits for those cohorts. But there's not necessarily rationality happening. And insofar as they have one, it's based on, it's circular. They come up with a reason and a rationality for their own things, but it's an internal system. Basically, it is a dogma. It's kind of a religion. Anyway, I'm going to give you a couple anecdotes. Tell me what you think, and see if they relate. I have like say a long-term, neighborhood friend, and we go back quite a bit, and we've had a lot of good times together. Anyway, he's a pediatrician and fairly prominent. And early on in 2020, he came down with COVID himself, and so did his wife and his family. Everyone survived fine. He's also a healthy guy, no cigarettes, blah blah blah. And so I said, he was the first one I knew who had it. I'm like, what was it like? I was totally, curious. And he said, kind of bad cold, borderline flu, blah, blah, blah. So did you take any medication? No, nothing. Anyway, he was sick for a few days, better. Standard kind of thing, occupational hazard. You see people, you get sick. Right. I've had loads of flus myself. And so I said, oh my God, I'm so happy you're healthy, blah, blah, blah. Are you going to still be wearing a mask? He's like, yes. I said, well, why is that? It's before mandated masks. And he said, well, it's just not the right time. I said, well, what do you mean not the right time? Do you think you can catch this again? He said, no. I said, do you think at this point you're recovered enough that you can give it to anybody else? No, I cannot give it to anybody else. You can't give it to your family, can't give it to anybody else. You can't get it again. I said, wouldn't it be a good measure, a good symbol, a sign for kids to show that there's a light at the end of the tunnel, that you can stop wearing one when you've had the illness? He's like, yeah, probably. So why won't you stop wearing one? He says, well, we haven't really been told yet. I'm like, told by whom? It's like, anyway, long story short, it was a political thing for him. Mm-hmm. Basically, the Democrat Party sees it still as an opportunity. And I said, well, what do you mean? What opportunity for what? He said, well, we have to get rid of Donald Trump. Wherein science is a tool for the government, for the productive social good, as it were, quote unquote, and stipulated. And I just think that this is again gets to the concept, the real core of medicine. In my book on Zika, I uncovered a lot of stuff that I had no idea about. And Rudolph Virchow, I remember reading a little bit about in medical school, but I didn't pay any attention. He espoused this concept of medicine for social change, that the concept of the physician was not really just to treat the patient, was to do things in medicine and announce things within medicine that would bring political change for, in his case, the underclasses. And I think this is really an inversion of medicine, and it's a perversion as well. I'm just wondering if you have any thoughts on the anecdote and whether you saw any of that type of thing, in your own realm.
Yeah, very much so. I would just say I did not know that about Virchow, but that's absolutely fascinating. You've convinced me to purchase and read your book now, because I have to get to the bottom of that. That this is interesting, because just parenthetically on that comment, Virchow is one of the two or three, probably with Koch and Pasteur, he's one of the three sort of the holy trinity of these early microbiology germ theory guys, right? Mm-hmm. And this is somebody who even then has this ideology about medicine as being something other than treating the patient. And, apparently, I don't think these people believe they can serve two masters. I don't think they're serving the first master. I don't think they're serving the patient. If that's your ideology, your friend, going back to your friend, if that's his attitude, I'm going to not do the right thing for my patients, who incidentally are children. I'm going to allow them to remain scared, to allow them to remain terrified, so we can get Trump out of office. I can tell you, I mean, that's essentially the take-home message I got from what you were saying. If that's true, I don't want my kids within 200 meters of this guy. And I mean that sincerely. And you can send him this thing if you want. I know you won't, but you could. I mean, that sincerely. You're supposed to be, as a physician, taking care of the patient, number 1, 2, and 3. And if it's not good for the patient, you don't do it. There's autonomy, and autonomy is heavily embedded with the concept of real informed consent. Okay. The second is beneficence, which means that if it doesn't do the patient any good at all, you don't do it to them. You don't take one for the team, which is what this was all about. You're taking one, everyone's taking one for the team. And then the third thing is the non-maleficence, which means you absolutely don't harm anybody knowingly, which we know that has with all the falsified data and the Pfizer trials and whatnot. And then the last one, of course, is justice. And, justice was turned on its head when, Boris Johnson's having parties and Neil Ferguson's sneaking out to see his girlfriend and everyone else is locked down. So, this is the kind of thing that we've seen just from start to finish with this. And what it means is you don't belong in this profession if you don't feel that the established ethics are the way you have to behave. You should be doing something else. I'll give you an example of a friend of mine. Won't give any names, but I was actually involved very much during late 2020 and 2021 in my neck of the woods, trying to get the schools reopened. And ultimately, we had a lawsuit that went throughout New York State, and we had a date in court to see if the hybrid learning had to be overturned and let the kids go back to school 5 days a week. And actually, the judge, the state Supreme Court judge who was on the case, was someone I know personally, thought was a good guy, thought was a friend. And literally the night before it went to trial, literally at the 11th hour, the night before, he recused himself from the case, citing that there was a conflict of interest. And under some arcane law in New York State, he did not have to state what that was. So he torpedoed our whole legal case because we were in March of 2021. We were trying to get the schools open, the kids back in before the school year was over in 2021. He recused himself from the case at the very last minute. We didn't get a day in court. They postponed it for several months while they assigned a new judge. And by the time the new judge came, it was summer vacation. And this is someone I knew and someone I thought was a honest human being. Didn't even hear the case and make a cowardly decision, just torpedoed the whole thing. So this is what we're up against. We're up against people who are completely unwilling to take a stand. You talked about abdicating your duties, which, let's face it, Jeffrey Tucker's made this very, very clear in his writing and stuff about what happened during kind of the Ides of March of 2020, where Trump basically was talked into ceding the pandemic response to Fauci and to the essentially to the military. It became a military operation. And this is what happened. People just abdicated their responsibilities to an absolute extreme extent. And, there's a lot of people I don't have a relationship with anymore. Maybe that's a punishment to them. Maybe it isn't, but there's just a lot of people I don't have time for anymore.
I know, it's funny. I don't know if you've read the Harry Potter series, but there's the sorting hat within. At the beginning, when they arrive at Hogwarts, they are, I guess, chosen one way or another. But it's witchcraft, so they're divined to be Huff and Puff, Slytherin, or Dumbledore. I can't remember.
Right.
You get the idea. But this became a sorting hat. Like COVID was, the Hebrew. There was a Hebrew term called shibboleth, which literally was a term that they used to check on spies. So it's a difficult word to pronounce, and it was pronounced 18 different ways from different dialects around the area. So if you said shibboleth, instead you said sibboleth or whatever, they could tell that you weren't one of them. So it's a sorting hat of so basically COVID, and it's become a word, shibboleth, and COVID is a shibboleth. Like how you reacted to this sorted out your friends. They're either going to be Slytherin or they're going to be a Huff and Puff, whatever. And we've had schisms. It's not just the Protestant church after the Reformation. There's schisms like in the neighborhood, and so people have vilified each other. Well, I think more the left vilifies than the right vilifies the left. But we had people over to our house, and we tried to keep everything on the up and up. We never stopped living, but people came for dinner parties outside in the cold, and we had heaters and all this kind of stuff. So we tried to accommodate. I didn't believe in any of that stuff. I didn't believe it was necessary. But there was one huge fracture. We played tennis, and one friend invited us to play indoor tennis in a huge pavilion, 60-foot ceilings. And somebody took a picture, put it on social media, and apparently all of her friends, her women friends, ostracized her immediately. They were unbelievably shocked. They could not stand the concept that they were endangering the world because they took a selfie, 4 or 5 people on the tennis court. I have to give you the honest truth. We all lived. We somehow all survived the tennis game, and we survived everything else. But it's been a constant case of what are you going to believe? The Fauci facts or your own lying eyes.
Right.
Nobody's dropping dead. It's not the zombie apocalypse. I'll give you one quick anecdote, just because I can. I was walking on my bucolic, leafy suburb street, and it's a pretty big street for what it is, very quiet, but it's, I don't know, like 25, 30-foot wide street. And I was walking in the middle of the street with my dog because it's a quiet street, and I don't want him to pee until he gets where I want him to go. So I don't want him to go on the lawn. So this is my thing that I've always been doing. I move over traffic. And there's a woman on the sidewalk. She's at 5-6 arms length away from me. And I'm not wearing a mask, and nor is my dog, mind you. But we're walking down. This is the midst of COVID hysteria, and she's on the sidewalk, and she sees me, and she's like so stricken by fear. There's a tiny little 2-inch berm of grass, and she leans over and she stumbles. She falls onto the lawn, and I'm like, I'm a physician. I'm trained to help. So I kind of go over her to, see if she's okay. I could pick her up off the ground. And this is even worse. So she kind of reverse crab walks backwards, like I'm a combination of the exorcist or the devil. And stay away. And so I did. And I hope she survived as well. But there's all this kind of secondary damage. I don't know if you ever saw The Invasion of the Body Snatchers, but it was redolent of that scene. I was literally going to, inhabit her soul and so forth by coming near her. And we were outdoors. It was a beautiful fall day or whatever.
All right.
I mean, I don't know how better to describe COVID.
Yeah, I think you bring up something, and incidentally, Invasion of the Body Snatchers is one of my favorite references regarding the whole COVID era. Partly because it's one of the keys to that story is you don't know who's one of them and who's still one of you, kind of thing. But I think that it really brings to a point your anecdote there about the woman crab walking away from you is. I realized very early on when I tried to go to, say, the superintendent of our school, go to other people and explain to them some of the statistics, explain to them what the real death rate was, explain to them how kids don't get sick, that kind of thing. We talk about literacy and we talk about illiteracy. Our society, by and large, I've concluded, is 90% functionally innumerate. They don't have any concept about statistics that's adequate to allow them to make an informed decision about risk on matters such as this. They're completely incapable of doing it. So they think that if you have a 0.3 or 0.03, you and I see that and we think 0.03, that's the flu. 0.3 is a flu on an exceptionally bad year, and 3% is truly alarming and highly unlikely. Mm-hmm. And we probably saw that right from the start and said, this is the way it is. But I think a lot of people, a tremendous number of people, I'd say the majority of people, don't have any way to conceptualize numbers in a meaningful way, certainly not statistics in a meaningful way at all. And if you don't have that, then it's very easy to scare the pants off people. And I think that's what happened. They absolutely terrified people. And that dovetails back to your friend saying, well, we got to get rid of Trump, so I'm going to keep wearing the mask. And you realize how insidious this whole thing is. We're going to do this, and we don't care what the downstream effect is to people's psyche. We don't care what the downstream effect is to society at large. We're going to do this, doggone it. And it's ideology taken to the extreme. It's a cudgel.
All right. So I'm going to actually segue, given our vast agreement on some of this, to your 10 sentences. Let's see. Where is it here? I'll have to just pull it up. I thought I had it up. I'm sorry. So I apologize for the break here. Can you tell us a little about your article, Solutions to Vaccine Troubles in 10 Sentences?
Right.
Can you tell us what those 10 sentences, I can put them up. How did you come up with that? What are your thoughts?
So a couple of things. Number one, I wanted to try and put together something that was fairly concise, that would say, okay, here's 10 points I want people to look at and to acknowledge, and look at them individually and say, is this sentence true, or is this sentence demonstrably false? And work your way down through them. And of course, I went to great pains to make sure that all of them were true. And then go back and say, well, if all of these things are true, then do you still buy the narrative that every child in the United States should be getting 20 plus vaccines before they graduate from high school? So, the first one I think is a good one just to show, and they're long sentences because I only gave myself 10, but they are complete sentences. And, vaccines are a class of medication. They're not something magic. They're not something in a class by themselves, if you will. They are a class of medicines. You would not ever say, the flu's coming to town, we're going to put everybody on an antiviral medication, because we know that if someone has a documented allergy to that medication, they don't get it, and we cope with the fact. But somehow vaccines are thought of differently. That's wrong. That's fundamentally wrong. Furthermore, the notion that they're all the same, that all of them are equally effective, equally safe, equally necessary, is absurd. Not all antibiotics are the same. Why would all vaccines be the same? They're not. So treating them all the same is insanity. The second is really a key one, and that is that if you really go back and do the research, and I encourage people to read Turtles All the Way Down because it's such a great book, but that there are numerous instances where vaccines have been pulled off the market and where they have been documented to kill large numbers of people and so on. And that's just an historical fact. That's not in dispute. So this notion that safe and effective is anything more than a mantra is absurd. There's multiple episodes prior to COVID where this has been documented to be true. So once you start going down the line here, and then this is something I really wanted to bring to people's attention is awareness of the National Childhood Vaccine Injury Act, which is the 1986 federal law that was passed specifically to exempt the manufacturers from product liability if they produce the product, within the specified standards. So in other words, they can produce a product that's going to kill some people, but if it's been approved and if they did it according to the standards, they are not in any way liable for that. Now, I'll tell you, that's a heck of a get out of jail free card to have. Mm-hmm. And the problem with that is, what does that do? That emboldens manufacturers to, number one, make as many vaccines as they possibly can because they have this tremendous product liability protection. And number two, it encourages them to push them as hard as possible. And that's exactly what's happened. It's exploded. The number of vaccines on the CDC schedules has exploded since that act was in place. And so, again, you were commenting on some of the differences between perhaps people on the far left and people on the right. And I think one of them is an acknowledgement of human nature. And I think that if you do not have a disincentive to do something that could be harmful, then you're going to have a lower threshold. By human nature, you're going to be more cavalier about what you do. And I think that's exactly what's happened with, I don't think there's any question that that's exactly what's happened with vaccines as a result of that act. And then, this really comes in large part from reading Turtles All the Way Down, but, the concept of herd immunity, which was really bandied back and forth throughout the COVID vaccine era, is surprisingly irrelevant for the overwhelming number of vaccines, because only a small number of them can even have the potential to really produce sterilizing immunity and herd immunity. But you wouldn't know that as a general consumer, because if your kid's late on their tetanus shot, well, the tetanus shot is tied into diphtheria and pertussis. So it doesn't matter that the only person a tetanus shot protects is the person who gets it in case they step on a rusty nail. That doesn't matter. They have to get it to protect everybody else anyway. And you realize that this is, frankly, Randy, it's a lie. It's a systemic lie that is passed down to encourage people to get every vaccine that's out there, and to encourage people around you to kind of put peer pressure on you to do so. So, we just have all of these factors that we can go on, but we have all of these factors in play that people don't realize, that people don't, that the people in charge will not acknowledge, that really call into question the wisdom and the safety of what we're doing here with these vaccine schedules.
Yeah, no, I appreciate that a great deal. Again, getting back to my Zika book, Zika is a flavivirus. So is hepatitis C. That's probably the most common flavivirus. And then there are the arthropod-borne ones. There's yellow fever. There's Japanese encephalitis, dengue. So an example that comes to mind for some reason is the yellow fever vaccine. I've given thousands of vaccines in my career. I was primary care physician, and I was pretty much conventional as you on this topic. And I've had my fair share of vaccines. I would get a flu shot every single year. I found it a very cost-effective rationale for myself as a physician, because I didn't want to be out of work for a week or 10 days and so forth. And I thought it helped me getting a flu shot year by year. I knew they weren't perfect. I kind of had an 80-80-80 rule, which is like, about they're 80% predictive and, works 80% of the time, and it kind of covers 80% of the symptoms. Anyway, so across the board, maybe averages out to about half of, the overall effect of the flu, which is fine. And I didn't have any problem with flu shots, but they can cause problems, as you mentioned, Guillain-Barré and whatnot. Anyway, but yellow fever, I've never given a single yellow fever vaccine. The fact that one exists doesn't mean everyone should have one. I talked with Steve Kirsch, and he was heading to Africa, and he was curious whether he should get a yellow fever vaccine. Now, that's a good case because he's not really on the vaccine bandwagon, but it really comes down to what your exposure is, what your risk is, what your personal risk is, where you're going to be in Africa. I mean, you could just be sitting in Cairo, which is technically Africa, and not worry about yellow fever. You could be in the jungle in the Congo, and maybe you should.
Mm-hmm.
Those are but it's not a simple yes no question.
Right.
It would take me a lot of time and effort to think about whether somebody, and it is also should his I mean, if he's bringing teenagers, should they have it? Should as a girl teenager different risk from a boy teenager? I mean, there's a lot of stuff. So it's not a simple thing. All of a sudden, because there is a yellow fever vaccination and I don't want to get yellow fever ever, doesn't mean I should get the vaccination because I may not be at risk at all, and so forth and so on. Anyway, so I actually looked into this thing, and I found that the risk from yellow fever vaccine of mortality, there are literally 3 orders of magnitude, 2 different studies with 3 orders of magnitude differential in the risk factor of mortality from yellow fever vaccine. One study was done like Gabon, the other one was done, I don't know, in Senegal, whatever, and they had totally different results. And so anyway, so should you get one? I don't know. Most people don't get one. So,
Right.
so does that make me anti-vax if I don't get a yellow fever vaccine? No, it doesn't. If I gave them, it wouldn't make me pro-vax. It would be that I'm a doctor and I'm trying to evaluate a given situation. This whole concept of making medical decisions was taken out of medicine. Like, why have physicians if you can't have them do any medical decisions? You might as well just go right to the robots. I frankly would rather have had AI treat me for a lot of things, as far as vaccines go, than physicians, because probably AI would have looked at more of the literature and come up with a probably more honest answer than a politicized cadre of physicians.
That's an interesting concept. If you really feed in all of the data, all of the studies, you really feed them all into an AI. It'd be interesting to see what they concluded.
Well, mind you, they have a political layer as well. I don't want to tout only my own articles, but I have an article in out. Let's see if we can cut this down a little bit. So I have an article. Jeffrey was going to publish it, but he didn't. So it's in Joel Smalley's blog. It's called ChatCCP, the know-it-all with flair, chatbot's hidden agenda. So ChatCCP, that's just my catchy term for ChatGPT. But the concept here is that I tried to ask the chatbots about vaccines and so forth, and I got kind of terrible answers. And they were clearly, the bot's smarter than this. When I say smarter, I mean it's more thoroughly able to access information. But basically, this is a cartoon I made from AI also. But basically, oranges they're all green, but they go into this ethylene gas and they turn orange. So basically, this is your true orange. Actually, they're green. But in the same very similar way, I didn't actually have that up. So yeah. This is the article, ChatCCP, Dead Man Talking is the blog, and the photograph I'm referring to is this. And so in the same way that this orange has a veneer of looking orange, the actual underlying information in the bot is covered by a human layer that's politically applied by the owners of OpenAI. We should rename this closed AI. So even now you ask certain things, if you ask literally what is a woman kind of question, or is transgendering a good thing for my teenager, you'll get a very politically charged answer that is almost always exclusively of and from the left. Anyway, I've taken a lot of your time already today. I'm wondering whether you might have some closing statements for us. And words to the wise and how people should get the best medical care for themselves.
Yeah, thank you. Well, first of all, thanks again for having me. It's a pleasure to really get to chat with you in detail and go over some of these concepts. And it always changes a little bit. Every few months, everything changes a little bit, doesn't it? And so it's very, very interesting to do. But I would say 3 things. First of all, as a patient, you have rights, and those rights are to, first and foremost, to refuse treatment that you don't want to have. The cornerstone of the first and foremost of the four cornerstones of medical ethics is autonomy. And autonomy is, in the best and truest sense of the word, my body, my choice. And this is, if medicine is being practiced ethically and decently in the way it's supposed to be practiced, you have a right to say no. I always tell the story. I've got one patient who has lived a very, very hard life, has not taken good care of himself, has, smokes, drinks, drugs, whatever. Came in one time, was having chest pain, and I said, I really need to get you over to the emergency room. And this guy said, I'm not going to the emergency room. And this was fairly recently. And, it was in the post-COVID era, the emergency rooms are even worse than they were before, right? So they really are hellholes. And he's like, I'm not going over there. And I said, I understand, but I think you're making a terrible decision. I think it could kill you. I think you may be having a heart attack. I think you're making a terrible decision. The guy looks me in the eye and he says, Doc, I've been making terrible decisions my whole life, and I'm still here.
There you go.
And I said, if you change your mind, head to the emergency room. But you got my idea. And to me, and he turned out to come back the next Monday, and I saw him and he was okay. We got an outpatient test, so I guess he was right. But my idea is, the reason I say that is because, even if I don't want people to make bad decisions, and I don't laugh at that because I am glad he disagreed with me. But ultimately, it's your call. You make the best decision you can. Make a smart decision. Don't do it like he did, but it's your call. And if someone tells you it's not, they're not telling you the truth. They really aren't. The second thing I would say is, you really have to be, in medicine, a lot of people kind of trusted the system for up until now. I know I trusted the system much more than I do now. And I think that you really have to be a caveat emptor type of person now. You really have to say, let the buyer beware. If you, best example, you get a vaccine and you have Guillain-Barré syndrome, that's too bad for you. That's not the manufacturer's fault. So just take these things with the grain of salt that they should have. Let the buyer beware. That would be my point number 2. And my third point, and this is more of a positive point, because the first two I think are perhaps a little bit, eye-opening in a way. I think it has for many people, and I encourage this to everybody nowadays. A lot of people said, hey, I got to start taking better care of myself. Because, sort of like this guy, I don't care if I drop dead. I'm not going to that emergency room. The system is not in a great situation right now in a great many ways. And so I really encourage people, if you're not doing it already, get the proper exercise, get the proper rest. If you're abusing substances, get the help you need to get off of them. Take care of yourself, maintain your relationships with the people that you're closest to. All of those things that are proven to be good for your health, independent of having to go into a system that may not be as beneficent as we thought it was. Yeah. And so I think that's maybe a positive thing to take away from it.
I like that. I would actually add, I wrote a blog post 15 years ago. Should the CDC, recommend you go to church? Something of that sort. They always tell you about broccoli and stop smoking and all that kind of stuff. But, actually longevity correlates highly with church going and or community service, marriage. And so the article was, should the food pyramid have like a wedding ring at the top? It didn't. Maybe I should go look at it and rewrite it. But it's one of those. I don't want the doctor telling me that stuff on the one hand, but it also, I think that they're really working on health on the edges, and they do whatever they want at any given moment. And they kind of, in 2020 they talked about going to the George Floyd riots was the better part of public health, even more important than social distancing. So there was it was the intersectionality of public health needs. So the need to riot, was more important than the need to worry about coronavirus. And now the need to have transgender quote unquote surgery is more important than the need to go through puberty, and the need to develop your reproduction and or see above, have a family, and get married, and so forth. So a lot of these, I would add to this that people need to be very careful about bait and switch, and they need to have kind of a firm moral standard and a moral standing from which to make judgments, and oftentimes that's hard to do on one's own. So for the people who are not huge believers, I still find that being part of a church, a synagogue, is a crucial part, because you have a way of at least having people who care about you in a different formality and so forth from people who might have had some of their scruples jeopardized.
That's a great point. I agree completely. I mean, I've always kind of stayed out of that side of things, but I think you're right. I mean, the data are there. If you want to live a long time, you get married and you don't get divorced. If you want to live a long time, that's just the reality. I mean,
there's a great book by Charles Murray, who's vilified often for his bell curve, which is an interesting work by itself. But he has a book called Coming Apart, and the oddity in that book is that he looks at two communities. I'm not going to get into it much, but basically the kind of the Harvardy, no offense, the Harvardy types are always espousing all the kind of liberal things for the poor, but in fact they live a very, very conservative life themselves. And in his book he talks about how kind of your prototypical Barack Obama, say, lives a very conventional life by all standards. But the things they recommend for the populace are more kind of libertine, and the people who wind up having the secondary results of those in the blue collar neighborhoods, more tattoos, more broken marriages, more single parent, they actually aspire to the same lifestyle. They want to be more politically conservative. It's kind of a study in contrast. Anyway, I'm going to leave that out there. I'm going to close by bringing up two things of my own. First of all, if people want to support my podcast, they can buy the book here. It's on Amazon, and even better if they wind up reading it, but they certainly have to buy it. And then the second part is, I mentioned this earlier about Omicron not being COVID-19, and this is my article in the Daily Skeptic from a year ago. I thought it would be that would be that, but it's still, they keep making a comeback. And here's Omicron, not really close genetically to the ancestral SARS-CoV-2, nor the early alphabet letters, so forth. Here's Alpha, Delta, and all that kind of stuff. And Omicron is really far afield. And even by the genomicists, they explain that it's it looks so different. It's not really. It's really an orphan, according to nextstrain.org and so forth. Anyway, so I'm going to leave that there. People can follow you on Twitter, I imagine. What is your handle?
It's at CJ Baker MD.
Okay. So, and I'm at Dr. Randall Bach. Let's see if I can pull that up for everybody in adequate time. Let's see. X is easy to write. And CJ Baker MD. If I can type and chew gum at the same time. Here we go. Clayton J. Baker, MD. So I'm going to put up your Twitter feed so people can see it and follow you. And
I'm new to Twitter, so give me a follow if you're willing, and give me a little boost. And working on it. I just got on 2 months ago, so trying to get a following.
Perfect. And so I'm on as well, as you know, and we'll have this up soon enough, and we'll go from there. So Thank you so much, Clayton. I appreciate your time. I really enjoyed it, and thank you so much for being with us.
It's my pleasure. Thanks for the opportunity.